This is Dr.Indra Cidambi, the psychiatrist from the United States of America. Today, I'm bringing in a question and answer session. Once again, there are so many questions from the viewers, and I'm going to take a few questions or even one at a time and break them into a real session. So in this episode, I'm going to talk about the first question that I got. What are dreams, and is it normal to dream? It's a very interesting topic. Dream is a royal road to the unconscious mind. It's a Freudian way of looking at it. So that means these suppressed emotions, issues, comes to the surface through dreams. That's one of the theories. So before we jump into all those things, is dreaming normal? 100%. Dreaming is normal. If somebody dreams, they are okay. If they don't dream, then they can live. Is that a myth? Yes, it is. You can live without dreaming too. Some people don't dream or don't recall their dreams. So it's not fatal that somebody doesn't dream right off the bat. So what is dreaming? Dreaming is while somebody is asleep during the REM sleep, which is the rapid eye movement sleep stage, they are envisioning the emotions, images, or the thoughts which get acted out. That is the vision that they are seeing during the REM cycle of sleep. So what is a REM cycle of sleep? Sleep occurs in 4 stages. So from the time a person tries to fall asleep, the transition from being awake and falling asleep is the first stage of sleep. And that is a non-REM sleep. The second stage is when the person is getting into light sleep and the temperature gets cooler. The body temperature goes cold. And so during that stage, it's called as a light sleep. This is again a non-REM sleep. And then the third stage is a deeper sleep. During this time, they might get dreams or they might not. But the fourth stage is called the REM sleep. The rapid eye movement is called the REM. So when the REM sleep happens, it happens 70 to 90 minutes after someone falls asleep. So once we are in that stage, that's when they start dreaming. Why should we have this REM sleep? This is like the brain getting rid of the toxins. So it is a detoxification of the brain. Simply put, that's the way it is. So if some brain does not do this job right, then if they were exposed to trauma and they are not getting rid of this trauma during this rapid eye movement stage, then they don't know how to cope with this trauma and they end up with a post-traumatic stress disorder. In order to understand this, we also have something called EMDR. And this therapy, they do the finger movements to make the eye have this rapid eye movement. Because the rapid movement of the eye, the REM sleep, is not doing the job. That becomes faulty. So by using EMDR, the therapists are able to help these patients process their trauma. So we now know what is sleep, what is a normal sleep, what are the stages of sleep. Let's dive right into what are dreams. So what causes the dreams? The dreams are the expression of what the person has experienced and or the emotions that they've faced, and it all gets acted out during the REM sleep. It can be fragmented. It does not even make sense to the person who's dreaming. So this is so important. Some people might wake up from this REM sleep and they might remember their dream for a little bit, but then they might not have the total recollection of it, and they will jot it down in a journal and then bring it to the therapist for further interpretation, or they might just forget it, or they might not even recall it. So everything is normal. Nothing's pathological in this. What are the types of dreams? We have lucid. Lucid dreams are something that the person can recollect and say, I had a dream, lucid dream. Vivid dreams is more of the vivid dreams that it's more like a reality. They recollect all these things like a reality. And there are dreams, recurrent dreams. It's a repeated dream that keeps coming up. And there are dreams which also will predict the future for them. So these are different types of dreams. All right. There are nightmares. When there are nightmares, it's a threatening, fearful dreams. And this happens due to the trauma, post-traumatic stress disorder and stuff like that. So this calls for treatment, further investigation. So I talked everything about normal sleep, and now we are going to talk about the pathology. So we started off with nightmares, night terrors. They're all related to post-traumatic stress disorders. And then there are something like, sleep paralysis. They can't move while they're asleep. And this needs to be, they're conscious. They are able to see that they can feel everything, but they can't move. It's a sleep paralysis. They can have narcolepsy. The condition called narcolepsy is a pathological sleep. During this narcolepsy, people, while they're driving, might fall asleep. All of a sudden, they lose control and they just shift from being conscious and doing something and directly into the sleep. That is very dangerous. Say suppose if they are operating a machinery or they are driving and they slide right into sleep, that is something very dangerous. So they lose control, right? They can hit somebody or they can hurt themselves. So that calls for attention and treatment. There are other types of sleepwalking. Sleepwalking happens, or sleep talking. So these are pathological ones. Somebody who's not able to get good night's sleep would talk to you about, hey, I just drink that, I take a nightcap. I drink this alcohol just to get good night's sleep. And then they realize this is not the way to go. When they stop doing that, now they have a problem. Now they have a problem where they're going to just not be able to sleep, and they're going to seek for a sleep medication. When they take that sleep medication, what happens to them is that they start sleepwalking. And this kind of sleep medication needs to be reassessed and brought to the doctor's attention. Or they might even sleep talk. That's not normal. Believe it or not, there are people who are blind, can't see dreams. They can see in their dreams, even though they're born blind. That's an interesting finding. And there's also the research saying that older people dream black and white, the younger they are, they dream in colors. And they relate that to, people seeing black and white television, and as they are getting older, that's what the dreams are. The younger they are, all these technologies now, 3D, color, the iPhones, the smartphones, and all these things, and the television, and the color, the visual effect that they get, social media. So those are the content of their dreams. So where is the most important thing to pay attention? If someone is deprived of sleep, it's not going to kill them, but their immunity is down. Their memory is really at stake. The decision-making skill is really suffering. They can't process the emotions, so they are getting depressed and anxious. And some of the psychological issues like schizophrenia might also lead to sleep issues. Most commonly, the bipolar disorder. People with bipolar disorder will not be able to sleep at a stretch for 4 days or more. And just that is not enough to diagnose this diagnosis. But the biggest difference is that if they are bipolar, they're not sleeping, but they are wired the next day. They're not tired. So that is a very distinguishing characteristics of bipolar not sleeping. So anyone with this kind of sleep issues should seek attention. They should go to their psychiatrist or a therapist or go to their primary care physician doctor and talk about it. All right? On that end, let me catch you guys with the next question of yours. See you until then.